Awesome. Well, we'll get started this morning. Appreciate everybody joining us. We're excited for the topic today and our guest speaker. And if you haven't had a chance to watch our webinars in the past, we like to do these webinars, and we have a number of different topics that can be found on the website. We actually have a brand new website, which if you haven't seen it yet, there's an awesome new website that our marketing team has spent time working on, and it has an area where all our webinars and our videos are listed. Our first series of webinars we did, if you haven't been to any webinar in the past, was specific to joint movements. So we did things like hip or knee or elbow, any joint specific, where we went through all the tests and showed videos of how to test. This webinar series called Investigating Injuries is specific to specific injuries. So we have guest speakers on and we talk a little bit through the injury, what it is, the anatomy, and then a guest speaker usually walks us through a case study and how we would treat that specific injury. And so today we're going to talk about heterotopic ossification following a total hip replacement. However, if you'd like to see our webinar on ACL rehab or hamstring injuries, all of those can be found at our website. So we're going to get started today. For everybody who's new on the call again, usually we're welcome to take questions. So if you have a question, feel free to type it into the chat. Usually what I'll do is I'll moderate the questions a little bit, where if it fits into the topic that we're talking about, we'll answer them kind of right away. And if not, we'll answer them at the end of the session. And then if there's enough questions, which we've had a couple times, that we run overtime, a lot of times we might have you reach out, or we'll do like a follow-up video that we can post that answers any unanswered questions. But we're grateful for you joining us this morning, and I hope that you get some good value out of the time we spent today. So just to do some quick introductions, again, if you've been here in the past, my name is Daniel Stewart. I'm a PT based out of Salt Lake City, Utah. I found Active Body, I believe, 5 or 6 years ago, and have been on this journey of trying to make the profession better when it comes to objective testing. And so we use the device. The device is FDA approved. It's been a couple of years since we've had to get that FDA approval, but we think that it was worth it and needed for skilled testing within the medical and clinical spaces. And then I'll have Matthew introduce himself.
Hey, good afternoon, good morning, everyone. As the slide says, I'm Matthew McDermott. My main role is Integrated Clinical Services Manager at Nuffield Ipswich Hospital, also an advanced level physio, injection therapist, and trainee MSK sonographer. I work concurrent to Nuffield with a football club in the United Kingdom called Tottenham, and do sessional work with the GB canoe slalom team as a contractor. I got introduced to ActivForce through a colleague that works with the Lawn Tennis Association. We were trying to drive forward our clinic and find a way of deploying data-driven healthcare. There's obviously a few different dynamometer options on the market. I think ActivForce is probably the best handheld device for sake of ease and comfort. And the two other factors I really like about it are the simplicity of the data analysis and the visual component of that. I red deficit, black not a deficit, whilst it seems quite simple, is hugely powerful. And the graphical representation from an educational piece with our clients, athletes and patients, often easier for a patient to see a graph than see a number. I think it's a great piece of kit, and looking forward to the session this afternoon.
Awesome. Thank you, Matthew, and appreciate your experience with the ActivForce and your willingness to jump on and talk us through some of your experience and how you test and some of the topic that we have today. Okay. So to go through our agenda, and I wanted to quickly highlight, we got some feedback, I think, for the last couple webinars about wanting to make sure that this webinar is as valuable as possible. And so I think historically we've spent quite a bit of time on things like the anatomy, or the appearance of the clinical appearance of a patient that has the specific injury that we're talking about. And I just wanted to level set with everybody that we have different people from different levels of education and study across the entire world. And so if we're going over a part that maybe seems a little basic or a little bit early on, or not as in depth as maybe you were hoping at the start, just wanted to let you know that we're hearing the feedback, and we're trying to keep that portion of it a little bit quicker and faster so that we can get to things like our case studies and treatments and stuff like that. So just wanted to let you know that we're hearing you. We appreciate the feedback. We love the feedback. And I do want to include some of this stuff, but we'll go through it a little bit quicker this time. So in terms of agenda, we already introduced our topic, which is heterotopic ossification following total hip arthroplasty. I'll go over a little bit the clinical presentation and the mechanism of his injury, as well as the common causes and risk factors. And then we'll do a really quick, brief anatomical overview of the hip and the periarticular structures. After that, we'll show some pictures of how we would use the ActivForce device, or inclinometer or goniometer in practice, to make sure that we're tracking things like the range of motion and strength. And then finally, we'll go over a case study where we'll have some data from the ActivForce device that kind of shows things that you should look out for when you're looking for heterotopic ossification in any body part, but specifically the hip. And then finally, we'll go into treatment and rehab strategies and a Q&A session at the end. All right. So really quick, I wanted to make sure that we all level set on what exactly is heterotopic ossification. In my PT career, it's not something that I've come across many times. Now, I didn't work in a setting where we saw a ton of post-surgical clients, which may be one of the leading factors in when a heterotopic ossification forms. But the word heterotopic literally means in an abnormal place. So it's ossification or bone formation in a place where bone doesn't exist. So that might be soft tissues, that might be muscle, that might be fascia, connective tissue. It's essentially anywhere where bone isn't normally. And so it's relevant to total hip replacements because it's a known complication following hip replacement. Sometimes there's reported incident rates of upwards of 40%, though not all cases are clinically significant. So why does it matter for us as physical therapists or athletic trainers, or some of the other specialties we have on the call, is that it significantly restricts hip range of motion and alter their biomechanics. Oftentimes, it may be progressive, where you may initially not understand, or maybe you're treating somebody and you're not understanding why their range of motion isn't progressing as your normal patients do. The problem is a lot of the symptoms can mimic other causes or other things that may happen after a total hip replacement. We mentioned some here: gluteal tendinopathy, post-surgical stiffness, increasing risk of delayed diagnosis. And so you may be treating a patient, and I remember a specific patient, probably the only patient I've treated with heterotopic ossification. It was following a total knee replacement and in the quad tendon. And early on, you can't feel the bone, you can't really see the bone, you're really just pushing. And I think the dangerous aspect, which we'll talk a little bit later, is that when it comes to heterotopic ossification, really extreme stretching and causing that inflammation response can actually increase the speed or the severity of heterotopic ossification. Matt, I didn't know if you wanted to add anything to these first couple slides.
Yeah, I think some people might not be familiar with heterotopic ossification, but it's in the literature sometimes used interchangeably with myositis ossificans. Some people delineate between the two, others it is used interchangeably.